Hi everyone, I'm Anush.
Hi, I'm Zainab.
I'm Nogi.
And I'm Lily.
Our topic is GERD or gastroesophageal reflux disease. What is GERD? GERD is a very complex condition which happens when the stomach contents flow back to the esophagus, and it can cause some unwanted symptoms like heartburn or stomach discomfort. And the etiology of GERD is highly associated with the LES or lower esophageal sphincter, and the lower esophageal sphincter is the sphincter between our esophagus and the stomach. Lower esophageal relaxations can cause impaired acid clearance from the esophagus, and this can lead to heartburn. Also, the relaxation of the LES can be due to the LES pressure and intragastric pressure changes. When the LES pressure is lower than intragastric pressure, this can open up the sphincter and the contents from the stomach can go up. And the causes of these pressure changes as well as the LES relaxations are due to hormonal changes like cholecystokinin, high progesterone levels, or some drugs like calcium channel blockers, antidepressants, or foods, high chocolate, high caffeine, high fat diets, alcohol consumption, as well as smoking. If not treated early enough, it can lead to some complications relate, for example, chest pain, chronic cough, laryngitis, Barrett's esophagus, and esophageal adenocarcinoma are some serious conditions associated with it. Peptic strictures and dysphagia, which is the difficulty swallowing, can also happen. Our client is Jack Nelson. He is male, he's Caucasian, 48 years old. He is working as retail manager of the local department store. His family includes his wife and two sons. They are in a good, healthy condition. The family history of the client includes problems. His father and mother had heart problems, and his medical history includes hypertension and right knee arthroplasty, which is the total knee replacement, which he had 5 years ago. Based on his complaints, we can state that he has some condition related to a GI, or based on these heartburn and constant indigestion, we can clearly state that it is actually GERD. Treatment includes OTC antacids, ibuprofen, multivitamins, and aspirin. The nutrition assessment was done measuring the biochemical test with the Bravo pH monitoring esophagram, and the endoscopy was done to identify whether or not the H. pylori was present, because H. pylori is actually associated with the inflammation of the stomach and some ulcerations. Here we can see that the ulcerations or lesions were not present, but the general gastritis, which is the inflammation of stomach, it is present. Medical prescription included lansoprazole. Lansoprazole is the PPI or proton pump inhibitor, which can help GERD. Aspirin and ibuprofen were discontinued because their NSAIDs, and NSAIDs are associated with exacerbation of GERD symptoms. Biochemical measurements which were not within normal range included the aspirate transaminase, the alkaline phosphatase, lactate dehydrogenase. His HDL, LDL, and triglycerides levels were not normal either.
As far as his anthropometric, he is 5'9", he weighs 215 pounds, and his BMI is 31.7, which classifies him as obese. His estimated energy requirement is 2,704 calories, and his water needs based on his weight are 2,704 milliliters. And his protein needs are 78 grams of protein per day. His related history for nutrition is he drinks 3 to 4 times a week of alcohol, and at home he has 2 cups of Crispix, 1 cup of skim milk, and 16 ounces of orange juice, while at work he has 3 12-ounce Diet Pepsis. And then if you look at the rest of his meals, lunch, late afternoon, and dinner, he does consume a lot of fried food and French fries, which is why we have images of the fries and the soft drink on the side. And these are all drinks and foods that can trigger his symptoms. He has no food allergies other than the fried foods that trigger his symptoms and make his indigestion worse. And for food preparation, it's either his wife prepares food or clearly he eats out, and then he takes 1 multivitamin a day. For our PES statements, the first one is altered GI function related to the consumption of fatty foods such as fried chicken and grilled meat, as evidenced by heartburn, indigestion, and medical diagnosis of GERD. Statement 2, excessive fat intake related to limited healthy cooked food options provided by the caregiver, which is his wife, as evidenced by higher than normal biochemical values of LDL cholesterol, triglycerides, and 24-hour recall showing frequent grilled and fried meat consumption. And the last one is excessive energy intake related to lack of time to shop and cook, as evidenced by 35 pounds of weight gain after the knee surgery and having a BMI of 31.7, indicating obesity based on the CDC guidelines.
Okay, so the nutrition prescription, it is based on losing 0.5 to 1 pound per week. We calculated his caloric intake range is between 2,204 to 2,454. And for his protein, 76 to 77 grams per kilograms of body weight, and water 2,204 to 2,454 milliliter. So for intervention number 1, goal is to nutrition education to restore the GI function in 4 weeks. Educate the patient on the relationship between fatty food and GERD, indigestion, and heartburn. Advise the patient to remove fatty meats and choose lean meat instead. Tell him to eat small and frequent meals and to avoid drinking beverage with meals. Advise to remove all of the food that are triggering his symptoms, and to do this for a week and then slowly introduce those foods back to his diet to monitor the problematic ones. And for intervention number 2, the goal is to give food recommendation to the patient to make his meal balanced within 2 weeks. To demonstrate my plate to the patient and his wife, advise the patient's wife to buy food from all of the food groups. Tell the client to focus on consuming leafy other vegetables, and less fat consuming fish or containing fish. Tell him to consume fats like flax seeds, avocado, and coconut oil instead of saturated fat like butter. Advise him to consume barley, oats, and other complex carbohydrates. And for intervention number 3, goal to advise to lose 2 to 4 pounds in a month. Educate on the dietary guidelines, to use MyFitnessPal app to stay in the calorie range of 2,204 to 2,454 kcal, and track the daily steps. And also after work, he can walk for 20 minutes in his neighborhood, or 2,400 steps.
So for monitoring and evaluation, number 1, do diet recall for the assessment part and check his notes to see if the removal of this triggered food were effective. And number 2, do a short interview with the client or a phone call with him and see if his wife has tried to make her husband's meals more balanced. And number 3, with the client, again, calculate the BMI and make a questionnaire to ask questions to see if the intervention has helped him lose weight, and ask questions related to the PA. See the track daily step on MyFitnessPal.
Thank you everyone for listening, and these are our references.